All right. So, good morning, everyone. Before we start, I'd like to acknowledge that most of us are meeting on the lands of the Ngunnawal and Ngambri people, the traditional custodians of the ACT and region, and pay my respects to their elders, past and present, and acknowledge their continuing contribution to the culture of our city and our region. As I've said, there's a fairly big crowd coming in today, so you can pop thoughts in the chat, any questions, and my trusty sidekick Penne will make sure that I don't miss anything, but I'll also have one eye on the chat as we're going. To introduce myself, my name is C. I'm the Health Literacy Officer at the Healthcare Consumers Association of the ACT. And what we do is that we're a health promotion charity. We've been in the ACT since 1978, and we're all about making the voice of the people that use health services visible in the health system. So you can have a say in how the care is delivered and whether it suits your needs. So if you're interested in our work, you can learn more about us on our website and sign up to more events in future. Today's Dying to Know Day, which is an annual day every 8th of August, where people have conversations about death, dying, end-of-life care. And we like to talk about advanced care planning because in the healthcare system, it's a really important way to make sure your needs and wishes are known if you cannot speak for yourself. That might be as you approach end of life, that might be due to an accident, anything like that. So it's a good opportunity to think about what you'd want and document it. I'm going to just share my screen, so give me one moment. So as you can see, we call this presentation, Advanced Care Planning, a conversation for everyone, because it's a bit of a misconception that it's for older people only. Really, anyone over the age of 18 should think about having one of these in place. So do share this information on with the other people in your life so that everyone's wishes can be known. Today, we're going to cover what an advanced care plan is for you all, and I'd be interested to hear in the chat or pop your hand up whether people have been involved in advanced care planning before. We'll also talk about why you should have one, some of the reasons that people give, how do you do it, the actual process, and then, of course, who can help, because it can sometimes be a bit of a hard process. So I want to start off with just asking, has anyone been involved with someone else's advanced care plan, or do you already have one? Feel free to pop something in the chat or speak up if you'd like. Taking that as a no, which means that I think we've got we've got a couple. So done one and use it with your mother, new to it, but just updated wills and enduring power of attorney. Yeah, that's a good prompt to get you started. Some people do have them, only about providing fact sheets. All right, so it seems like quite a few people are new to this. And those of you who've already got something in place, you can also use this information to review your existing one, which is a good idea to do at least once a year. Maybe around Dying to Know Day is a good prompt for you. So when we talk about an advanced care plan, yes, it's a set of documents. It's something that you'll have on file with the hospital, but it's also about the process to get there. So you'll be thinking about what your values are in healthcare and talking to important people in your life. And so it's a process as well as that set of documents, and it's all about respecting your future healthcare choices. So if you can't speak for yourself, you've thought about what's important for you, and people know what's important for you. You've had that conversation with the important others in your life and you've appointed someone to speak for you, but it's really important to have that conversation with more than just that decision maker so that everyone's on the same page and making sure that you've written it down and given it to relevant others. So there's a bit of a journey to go on to get a full advanced care plan. When we talk about the why of it, a lot of people will say that they want to be comfortable that their wishes are respected in healthcare services. So having it written down is a really powerful way to make sure that happens. It makes it easier for other people. So it could be that you don't want to stress out your family if something were to happen and you weren't able to make the decision. You want them not to have to worry about whether they're making the right call for you or not, because it's really clear what you'd want. Doctors might choose less aggressive treatments if you've said that's what you want, because they tend to err on the side of preserving life under all circumstances, and that might not be what you want. So you need to say that. And we've got a stat here that says about 1 in 4 people aren't able to make their own end of life decisions, but I've seen in varying places it's probably closer to 1 in 2, which is quite a lot of us. So I'd be interested if other people have any reasons that they're interested in why they came along today. So pop those in the chat or hand up if you'd like to say something. All right. I mean, so, some of the other reasons I've heard, yeah, things like to add to your will, or if you've, I want to have one in place because I've got poor health, yeah. So if you've got existing health conditions, you want to make sure that those will be looked after, or you might have some hospital admission coming up. Some people don't trust their family to make decisions according to their wishes, yeah. So I have different views from my own parents and my own grandparents about what I would want in those circumstances. So it's really important to make sure those wishes are clear. Okay, great. Mhm. So to step you through the how of it, and we'll work through this step by step, we start with working out what's right for you, your values. So you might never have thought about, well, if I was in hospital, I couldn't speak for myself. How would I want to be cared for? What's important for me? What do I want or not want? But you also want to think about, well, what does a good quality of life look like if someone else had to make decisions about where I was cared for, about what kind of recovery there might be? You then want to talk to those relevant others in your life. That could be if you've got existing health conditions, your own healthcare team to understand, well, this is what might happen. You might want to put down a wish around this specific treatment because of that existing condition. But you might also be talking to the people who's going to make your decisions and other family members. So it could even be children that might not be the decision maker, but you want them to know so that there's no arguments around the issues or that they understand what might be happening. And once you've done those bits, then we get to filling out the forms, which I'll give you a bit of a rundown of what those look like, because they can be a bit intimidating. And at any point in this, you can get help with the forms or the conversation, and there's quite a number of places you can get help. Even if you've got a question, we can try and answer that here today. So to get us in the right frame of mind, run through a bit of a scenario. So think about if you won a big overseas trip. Think about how you might plan to make the most of it. It's once in a lifetime thing. You might be given $20,000 to go to the other side of the world, do whatever you wanted. But in this scenario, there's a catch. There's some rules. You have to go to an exotic destination somewhere you don't speak the language and you don't understand the culture. So I've got a picture of Greece because I don't speak the language. I don't really know the culture, but I'd love to go. And from there, how might that affect your planning? You might be allowed to have a guide. So the guide is a person who knows what you want. You've had that discussion with them before. You might talk about how you want to be treated, where you want to go, and so I will go to Greece and I might grab a friend, my friend Alex, who's Greek, to come along and take me on a tour. We've had a discussion. We're both really into history, so I want to see historical sites, and that's where he'll take me and guide me. So you'd have a conversation with them about the journey you want to go on. But of course, if we're thinking about healthcare scenarios, family scenarios, it's probably a bit more complicated than that sort of thing. So your guide is your travel guide, is your interpreter on holiday, and sort of they're your enduring power of attorney in a health situation. So they're legally appointed to take the reins and interpret what's going on according to the wishes you've discussed. But it gets a bit complicated. You could have two guides. You could have two attorneys appointed, which is something you can do with the forms. Someone might not be available. So in the travel guide scenario, Alex might have to come back to Australia halfway through and his brother George takes over. But George is a bit more of a nightclub beach type. And so I want to make it really clear that actually that's not really what I want to do. So you need to know my wishes. He and Alex might disagree on how they'd approach it. So it's important for us to have that discussion beforehand. What does the itinerary look like? So you probably write that down if it was a travel guide scenario, and you do the same in an advanced care plan. And we do this with a document called a statement of choices. So To get to that statement of choices, we need to start by thinking about our values. So we'd be thinking about the way we live day to day. What's really important to us? Are you someone that needs to see nature and get out and see the sky? Is that really critical to you? Is it critical that you are in contact with your community? So people need to make sure that you can go be with your community, whatever way possible. Could be things like attending church, social groups, or just making sure that people can visit you. And if you think about it, that might influence where you go for care if you weren't able to live independently. And then, of course, you want to think about the values you have about illness, aging, and death. So, is it really important that you stay independent as long as possible? Are you someone who wants to stay out of residential care for as long as possible, or are you okay with that? Would you prefer a kind of natural, well-supported end of life through something like palliative care rather than really aggressive treatments to keep you alive? So those are the sorts of things you might think about. And knowing and sharing those values can help people make decisions for you where you haven't really written it down, because there's hundreds of treatments that could be used to keep you alive. And you really want people to have a way to make those decisions, even if you haven't got the detail of every possible decision. So talking about the way we live and what's important is really critical there. I've popped on the slide, and hopefully we'll be able to pop it in the chat, a website called My Values, which I've found really useful in the past. You create a login, so you can do this as slowly as you want if you want to work through it, and it'll give you a quiz. I think last time I checked was about 34 questions that looks at what different kind of life supporting treatments you might want. It looks at things like what's important to you in regards to communication. What does communication even mean to you? Is it as simple as being able to gesture and raise a hand, or is it being able to talk? And from that, it'll create a report for you that you can include with your advanced care plan with some more of that detail and help you work out those decisions. But there's a simpler way to do all this. And in the follow-up email from this, I'll send you a little worksheet so that you can do this at home, where we use these values cards, and whether you print them off on a grid or there's even an online card game which can help you sort these out. And these cards help you think about some of the things you might have to consider as your values. So we've got ones like, well, what's important to you around having your financial affairs in order? Is it important to you to have human touch? Is it important to you to trust your doctor? So if you're interested in working through your values with someone, this is a great little tabletop exercise where you can circle and add more. So has anyone got anything that they see there that kind of jogs what's important to you? Feel free to share that in the chat or speak up. Or is there something that you don't see on there that you'd really like to include? Something about respect in all of those on the page. Yeah, so respect might be really important. I know that in here there's to trust my doctor, but I want to know that my healthcare team respects me. Agency, that's another really important one. And that's sort of linked, there's a few here around things like maintaining my dignity. Part of that for you could be agency. Yeah, covers a wide range and gets you thinking. Yeah. Elective dying choices. So things like voluntary assisted dying are going to be a possibility in the ACT in the coming years. So that's something you might want to think about. Those voluntary assisted dying specifically won't be included in an advanced care plan, but while you're thinking about this, it's a good idea to write down what you're thinking so that you're prepared for that. Right. So this is the kind of work you can do with people, and it's great to, as I say, I'll send you all this that worksheet, and you can print it off, you can draw all over it. It's good to work through it together, especially if you're a couple both working on these at the same time. So you choose those that are most important to you, add something that aren't on the list, add little extra bits like that point about agency might be really important for you. And you can use that to build out your advanced care plan. If writing's not the best way you express yourself, you might make a video for your decision makers or a recording. And of course, use this to help you talk about it with relevant people in your life. I'm going to play a video now, so hopefully you'll all be able to hear it, and I'll turn on captions for you.
Do you feel you would know my preferences for my future health care and could make sure they're met if I was ever in a situation where I couldn't express my wishes for myself?
I do. I think we know each other well enough that and share enough values in common that I'm fairly confident.
When Mum was in her last days and unable to make decisions for herself because of her dementia, how did you feel Dad processed the turn of events?
I don't think he processed it very well at all. They had nothing in place. They had not discussed that between the two of them.
I was walking, I was running, I was on a bike. I mean, it was just, I was just doing all that kind of healthy things, and suddenly within a day I'd got a runny nose, and next thing I'm in dire straits.
What do you think are unacceptable outcomes of medical treatment after illness or injury?
I think a lot of those unacceptable outcomes would be related to my cognitive or my brain function. If I was significantly impaired and couldn't think clearly and couldn't communicate with others, I don't think I would want to be kept alive. No.
When the doctor said to him, "There's nothing else we can do for your wife," I literally saw his heart break in that moment, because he had no idea that that was coming.
What were the risks you took with my life making those decisions? An example, did you know because of the chance of brain damage that I would have to learn to speak and walk again? And did you think that I would have been okay with that?
That's a tough question. Our understanding of each other was paramount to this sort of decision making.
I think I would do the right thing by you. I still feel it would be really hard arriving at that point. But then I put myself in that position of having to possibly, let go of you.
After Mum died, I think he thought, I don't want the kids to go through that. So he did an advance care directive and discussed it with all of us.
How do you feel about the decisions that were made for you?
I'm forever grateful. I mean, really, without some of those decisions, I wouldn't be here talking with you. It's something I can't thank everyone enough for doing that.
He wasn't in the state of mind to be able to make a decision for himself.
Having that advanced care directive in place made our decisions so much easier. I think his main objective was he didn't want us to have to make those decisions and go through that guilt and regret. I think he would have felt proud of us. I do.
I think he would too.
Because that's what he wanted, and we followed what he wanted.
Do you think we need a directive now?
I think we probably do. In as much as there's no certainty about life.
The thing is, once you've actually experienced something like that, after the fact, I've seen the trauma that has caused everyone, and that would have been alleviated, I believe, if there was some kind of plan put in place.
All right. So I include that video. I mean, you're all quite on board with the idea that you need an advanced care plan. You're here today. But I include that to sort of show how some of the conversations around this might play out, how you might raise it. So we had those sisters talking about what happened with their mum and then the way their dad approached it. So you might think about, well, this happened to someone else, and I don't want it to happen to me or to my family members, and that can be a way to raise things. I also find it really interesting, those brothers talking, because one of them came back from quite a dire health situation where other people had to make decisions unexpectedly, and hearing that perspective to talk about, well, what would, if something like that happened again, would I would I have things done differently? So think about those conversations and the way you might raise it with your own loved ones. We also have these conversation starters from Advanced Care Planning Australia, and all of these links will be shared in the email afterwards. But you might think about talking with people about what's most important to you in life. So being able to get out in the garden, go outside, be in touch with nature is really important to a good life for me. Or it's important that I see my family to live well. It's important that I see my close friends to live well. So if I had to go into care for some reason, I'd like people to be able to visit me. And for you, what is a life worth living? What does that look like? What's that acceptable standard of recovery, as that first couple was saying there? You might talk about your own life in terms of what's on the bucket list. What would you like to finish off that people might be able to make happen if you can't necessarily make the decision? And then, of course, about the choices. So if this scenario happened to me, if I was in a car accident, if I had a surgery and things didn't go to plan, what would I want to happen? And you can use these sort of prompts to help you get the conversation started with your family, your friends, and whoever's important to you. A few tips around having the conversation, and these have been picked up through doing these presentations, so advice from people who've been through it before. Things like choosing a quiet place with no interruptions, but it doesn't necessarily have to be somewhere like at home. I've had people say to me that doing it at home around the kitchen table felt a bit enclosed, a bit intimidating for me. So I went to a cafe and we sat outside, so we had open space, and that made it a bit easier to have that conversation, whatever works for you. Being patient and taking your time, because forcing the conversation means you might not think things through fully. Of course, if there's something urgent, you might not have the opportunity, but that's why you want to start early. But taking that time so you can work through that decision, and so that the other people understand why you're making certain decisions, so that if something that you haven't thought of comes up, they can still make something in line with your wishes. And letting that conversation happen naturally. I remember one lady telling me that she tried to have the conversation with the kids. They only lasted about 15 minutes before they went, "Mum, can't do this." But she'd planted that seed, and they were able to come back a few weeks later and have the conversation in chunks, which meant that they did get through it and they had time to process. Mum's talking about what might happen if she was dying, and that can be a bit confronting. So it's important to remember that you don't have to talk about everything at once. You can work through it bit by bit. It's an ongoing conversation. You can revise your advanced care plan at any time, and it's a good idea to update it at least once a year. And starting that conversation can be the hardest part, but even if you start with a little conversation, just get the ball rolling. Right. If there's any questions about the conversation, feel free to pop them in the chat. And we'll start to move on to the forms. And a lot of folks that I've talked to about this feel like Bernard Black here yelling at his tax form, that why is it like this? Why is it complicated? It feels very legal for some people. And that can be a bit intimidating, but I promise you they're not as hard as they look. Just in the chat, are there any resources designed for advanced cancer planning specifically? I know that there's a good resource from the Cancer Council on advanced planning. I'll see if I can find it to include in the email. Otherwise, the Advanced Care Planning Australia website has a few condition-specific guides, so I'll see if I can dig that up and send it out to everyone. Other examples, yeah, we'll work through some examples as well, and there was not much space on the form. So we'll talk about the statement of choices in a minute, but you can add more space if you need it. So just to give you an overview of the forms, we tend to think of it as sort of like a cupcake, with your enduring power of attorney, which is a sort of foundation document where you appoint someone legally to make decisions for you. And that's sort of the plain cake. It's the bare minimum for a morning tea, that sort of thing. It hasn't got much pizzazz to it, but it is the core of this process. So that legal document, you appoint someone who's over 18, who's willing to accept the responsibility. They also have to sign the form saying that. And you can nominate more than one person. So you can also say one person can make decisions about health, one person can make decisions about finances, if you're also doing the financial planning side of things as well. You can also put in some specific instructions in that form, but this one really doesn't have very much space because it's a legal form to appoint that decision maker. So they haven't included all the detail. Then we have the statement of choices, and the statement of choices is a bit of a friendlier document. It's got more space for you to write what you need, and it's kind of the frosting on the cake. So that makes it a bit more special and adds a bit more flavor to it. That's where you'd be writing about your values, and I'll show you some suggestions for text when we get to that as well. And then some people will also have a health direction, and that's a specific form about when to withdraw specific or all medical treatment. And there's a question in the chat about, can you appoint the public trustee and guardian? And I'll just jump over to the enduring power of attorney. So for some people, if you haven't got family who are available in the ACT or friends who are willing to take on the role, you might talk to the public trustee and guardian and fill out the form with them. And if you get their help to fill in the form, they like to put themselves down as an attorney or at least a substitute. And what happens there is that if something were to happen and this form would be enacted, so when you lose decision-making ability, that's the point at which this form is enacted, they would have appointed a guardian from the public trustee and guardian to make those decisions as needed on your behalf. And the way that works is that they follow your stated wishes as much as possible if they can, and there's a decision that needs to be made. They'll talk to other people in your life that would know your wishes, but documenting that is a really good idea if you might need to appoint them. They're also appointed in emergencies where people don't have a plan in place. So I hope that's helped, but I will also include some links as well, because that's where most of the questions for today have come in. So on the enduring power of attorney, really, you start off with just appointing up to, I think it's up to 4, so a couple of attorneys, and then you can appoint a couple of substitutes if they're not available. It's really important that they're contactable in case of emergency, so appointing your relative that lives on the other side of the world probably isn't the best idea. They don't necessarily have to be in the ACT, as long as they are contactable though, and having a backup is a good idea. Right. Then we get to the more interesting form, in my opinion, which is the statement of choices. And this is a guiding document for that legally appointed decision maker. So this is just a picture of the front page where really you're filling in your details, saying whether you've got an enduring power of attorney filled in or not, and who are the people. You'll also say if you've got a health direction, so there's a 1 page of where all your documents are. You would also say whether or not you're an organ donor. This is a good time to think about that as well. And down the bottom of that front page, it has a little checklist of all the places you should be sharing this document. So sharing copies with your decision makers, family members, your GP ideally should have something on file, and then of course my health record and the hospitals, and I'll share some details for how to get it up there as well. On the statement of choices, though, there's about 4 pages and a number of sections. So in part A, you are talking about your values and wishes. So the first question on that is around what would be an acceptable level of recovery for you after a major injury or illness. So these are some examples that people have put on their forms. So It would be unbearable for me if I were dependent on others for care and mobility, and I could no longer communicate or eat or drink. So that's a really clear statement of this is what would be unacceptable to me. So if I wouldn't be able to recover beyond that, then you might put me into palliative care, for example. And that statement, because it's general enough but clear enough, means that whatever treatment path is coming their way for decision, your decision maker would be able to think about your values with regard to that decision. So you don't have to jot down every possible life-supporting treatment in there. Some people have said things like to stay active and independent as long as I can. And another one would be, as long as I can understand and communicate in some way, that would be acceptable to me. So that might be where someone goes, look, even if I could raise my hand or, communicate with my eyes, that's still acceptable to me. Everyone's got very different views on what that acceptable recovery looks like. The next two questions are more on your values and wishes in this section. So we've got what should your treating team know about your current health conditions? And I know we've got quite a few folks from Arthritis ACT here today. So you have conditions that you might want considered by doctors. So one of the ones we've got here is lying on my left side is painful. So you might have had a hip replacement or something and that's painful for you to lie on. So telling people what makes you comfortable, how do you manage that condition day to day? Do you have any mobility aids that you don't want to get lost? It might be about continuing your regular medications. Certainly people who might be like trans might want to make sure that their hormones are continued. If they're taking those. And things like what aids do you use? So I'm hearing impaired, please make sure I have my hearing aids. Even if you're not able to make decisions, you're not able to communicate for yourself, you might still want to make sure you can hear people. So that might be really important. So tell people a bit about your current health conditions. And on the form, there's only a box, not very big. Can add more pages, particularly if you've got a complex medical history. You could add another page to give some more detail. And then there's a place for other important information. So one example is of giving a message to your family when they have to make these decisions. So tell my children that I trust their ability to decide for me and support each other. So there's some encouragement there. But you might also be putting in something about your pets or your cultural beliefs, that sort of thing. Where would allergies fit? Allergies you would want to put in your current health conditions, but also if this is going to the Canberra hospital, then it would be important to make sure your allergies are up to date with them on your medical record. And I'll get to that other question as well in a moment. Then we have part B of this form. So the next page of this form is about your wishes for CPR and life-prolonging treatments. So as I said, there's quite a lot of life-prolonging treatments, so you want to give a bit of information about your reasoning so that people can make decisions if there's one that you haven't thought of. You can say, I would like all appropriate treatments to keep me alive as long as possible. That's totally fine. And nowadays there's a tick box on that where you can just say, that's what I want, and you don't have to write more if you don't want to. Some people might say, don't keep me going if I'm not responding. So don't keep pushing if it doesn't seem like I'm going to come back. Or I only want these treatments if they're likely to help me recover to the quality of life I've stated in my values and wishes. So that calls back to part A. So you could have stated really clearly, this is the quality of life that's acceptable to me, which means that I only want CPR. I only want life-prolonging treatment if that's likely to happen. And some people would say, I prefer a natural death with family around me and my pain managed well. So asking to move towards that palliative care pathway. You can also add in here, there's a whole section on choices if you're nearing end of life. So you might say something like, I'd prefer to die at home, but I'd accept hospital or hospice care if needed. A lot of people get worried about putting their loved one into care because they've said, I would like to die at home. And that sort of, but if it's needed, can be really helpful for family members to know exactly what you'd want. some people would say something like, I'm hoping for a natural, peaceful, dignified and well-supported end of life. So it's about the dignity there. I want it peaceful and supported. And you might talk a bit more about what that looks like to you. Some people might have some cultural, spiritual practices that they would like to take place before they die. It could be, I want to contact my priest to come see me or speak to my family and guide them through this. And pets are a really important one that you might not have thought of, but knowing that your pets are cared for is really important, and you might want them to come see you if you can. So I'd want my pets to be close by and cared for after my death. They might be really important, and you can put that in here. So that's the third page of that document. Ooh. And the last page of that document, it's 4 pages if you use the template and you don't add any extra, is just you saying that you're of sound mind and having it witnessed. But there's also a place on there to review your document. So if you have no changes to your document in a year's time, you can just say, I've reviewed it on this date, and then re-upload that or share another copy of that so people know that these are your current wishes and there is no confusion about what you currently want. Because sometimes if a form is, 5 or 10 years old, people might not be sure if those are still your current wishes. So making sure that that is reviewed. So I'll just get to that question now. Just a question on data storage and privacy. If the document is updated each year, are the old ones destroyed by the authorities? So I'm not totally clear on the destruction process. I know that there's a policy around how the health services need to get rid of anything on paper. If you're uploading it digitally though, which a lot of people are doing these days, then the old file's just taken away. So that's my understanding of that. I'll see if I can find any information on data and storage. It's a good idea to make sure that you're not necessarily leaving these documents lying around. You might pop it in a safe with your will so that it's nice and secure. The last form that you might do as part of your advanced care plan is really just this one page. It's very straightforward and it's very specific. Not everyone will have this thing. It's a health direction, and we think of it as sort of the sparkler in the top of the cupcake. Yeah, and the point of the health direction is that if you are wanting treatment withdrawn or stopped, whether it's a specific treatment or all treatment at a certain point, you can be really clear about that. It's a good idea to fill out this form with the doctor so that it's clear for doctors, and it's like right on top of your file to say, this is exactly the point where I want treatment withdrawn. So if you're in long-term treatment for something like cancer, you might have a health direction in place to say, if it's not effective after this point, please stop. It's also used in things like medical trials, so that it's really clear that, if a treatment isn't effective or if I'm having certain side effects, I want to stop. So not everyone will have this, but it is good to keep in mind. The thing about the health direction is that it's also a legally binding form alongside your enduring power of attorney. So if they don't agree with each other, the most recent form will be what's followed. So it's a good idea if you add a health direction to make sure your enduring power of attorney matches and is up to date. Right. So once we've got all those forms, that bundle of a few documents, you want to give copies of your plan to a few key people. So your attorneys, those people or one person that you've appointed to make those decisions. Good idea to keep the original yourself and just send photocopies to people. Other family members and carers, maybe to have a backup so someone else has got it, but also so that other people are aware of your wishes and you don't have those bedside arguments as much. To your doctor, whether that's a specialist who's looking after you or maybe to your GP. Your GP is a good idea because they've generally got all your medical records. Your local hospital, so Canberra Hospital and North Canberra Hospital, now we can submit these online quite easily using the ACT Digital Health Record. But if you're going into a private hospital, you can use the same forms and submit those, say, before you're going into surgery. And some of them will ask for it beforehand. If you've got support providers, people coming into your home, or if you're living in like a residential village, then it's a good idea for them to have a copy on hand. But also if you're moving in somewhere and they like a residential aged care village and they're insisting that you have an advanced care plan, they're not allowed to have any influence about what your decisions are on that advanced care plan. So make sure that you're making those decisions independently. And it's a good idea to get this done early so that there's no influence over your wishes on that form. You can pop it on the digital health record. If any of you have used the MyDHR app or the website, you can upload it yourself nowadays. If that's a bit too complicated, you can also submit it by email, which I'll share all those details, and you can mail it in if you're still someone who uses paper. All those ways will work. It's also a good idea because the ACT health record and the federal My Health record that's national, they don't necessarily talk to each other. So when I send out the links, we'll have a link to how to put it into the My Health record, which is a good idea if you're going traveling, because anywhere in Australia, of course, with your consent, a doctor would be able to access that. So if you end up in hospital while you're on holiday in Queensland, it will be there as well. Question around how secure is the DHR? I can't comment because I'm not a cybersecurity expert, but you do need things like two-factor authentication. So you need to get a text or an email to get into it. So it is quite hard for someone to get in with your details unless they've also got your phone or your email. And if you don't want to use the MyDHR app, you don't have to. Okay. So if you want to lodge your forms by mail, there's the address and we'll also send that out to you. And you can also email in a scanned copy and they'll put it in your digital health record for all the ACT public health system. You will still need to add it to My Health record yourself because their systems don't quite talk to each other. Your GP may also be able to help you with that if they use My Health record. So who can help with this process? Thankfully, we've got a few people. I can answer some questions here, of course, but if you're, say, getting information for interstate, because you're moving interstate, then the National Advanced Care Planning Support Line covers everywhere, and that's run by Advanced Care Planning Australia. They're quite useful for answering questions for folks who might be over in New South Wales. We're lucky in Canberra that we've got a small team that works from Canberra Health Services that just works on advanced care planning, and you can give them a ring or send them an email and they'll answer any questions, but they also have appointments with people to work through their plan with them. So you can go yourself, they'll do double appointments with couples to work through that, and you can have multiple appointments if it takes you some time to get through those documents. So do encourage reaching out to them if you'd like some help doing this. A lot of GPs are also trained in supporting people with advanced care planning, and it's something that a GP is supposed to do, but more and more practice nurses are also doing it. So do ask your GP practice if there's someone who can help you with this. And just on those advanced care planning appointments, you can book in through the advanced care planning team to meet up with someone at the Canberra Hospital or North Canberra Hospital Monday every week, at the Canberra Hospital on Tuesday. They're at University of Canberra Hospital on Thursdays. So if that lines up with any of your other appointments, that might be really helpful. And they're at Council on the Ageing at Hughes every Thursday as well. So there are a few ways you can book in an appointment to get these done. And after today, I'll send you all the forms. You could do a draft and take that along to finish it off with them. So now I've got a bit more time set aside for questions. Would anyone like to jump in with further questions in the chat or pop your hand up? Some people have to head off.
All right. We've got one just now. What happens if an emergency arises and none of the attorneys are contactable?
Okay. So it all depends on the specific scenario, but if you've got your advanced care plan on file, then that can provide some guidance for doctors for what to do in that scenario, especially if it's quite clearly within the advanced care plan. So that's one reason to make sure you've got this documented and in the system. If none of the attorneys are able to act as an attorney, that's when the public trustee and guardian might appoint a guardian to make those decisions, but they won't do that unless someone is totally unavailable. And in those circumstances, they'll act according to the wishes that are documented as far as they're known. And I'll include some information because we had a few questions about how the public guardian works. I'll include some information in the email out, but the way that they work is to use what wishes you've previously stated, talk to people in your life about what you'd want, and as much as possible, keep people engaged in the community. We did have one of the other questions in the registration about what happens if the public guardian's needed outside of hours. So if they're not available, they have a 24/7 contact number at ACT hospitals and the Administrative Tribunal who manages these decisions. So if there is an emergency and it's outside of office hours, then those facilities have a direct contact. Otherwise, they'll try to keep any major decisions only being made during business hours.
Steve, just got a... Sorry, Steve, there's a question from Jill. Is there a charge at all for the support services?
For the support services, no. So those are all free services to get those appointments. I believe if you're doing an enduring power of attorney with the public trustee and guardian, and it's not just about healthcare matters, there may be a charge. But if it's just about healthcare matters and you're doing it with the Canberra Health Services team, that's totally free. All right. Well, thank you all for your time. As Pene's popped in the chat, we've got a form to get feedback so we can keep improving these and let us know what other sessions you might like. We'll also share a recording of the session so you can revisit it afterwards if needed. And I just want to finish with sharing. First off, we do have some other useful websites that are available. And again, these will all be in the email out. Canberra Health Services, Advanced Care Planning Australia is also very good, and our own Canberra Health Literacy Hub has everything I've talked about today available. There's also some American websites like the Conversation Project that are really helpful for these end-of-life conversations. And then this little reminder from Snoopy, someday we'll all die, Snoopy, says Charlie Brown, and that's true, says Snoopy, but on all other days we will not. And I just want to reinforce that putting these in place, even if it's a bit difficult to get through these conversations, can give you that peace of mind to keep on living your life as you'd like to. So remember that while you're having these conversations, and thank you all for your time.